Hello viewers, you're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong Egbene, a consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Ibom State, Nigeria, and a lecturer with the University of Uyo. In our previous videos, we had considered the symptom headache, and we had said that headache could be primary or secondary. Primary when there are no clear underlying causes, and secondary when there are clear underlying causes. And in several videos, we looked at brain tumors, then we looked at head injury as a cause of secondary headache. We also looked at chronic subdural hematoma. In our last video, we had started looking at a condition called stroke, and we said that there are two types, the ischemic and the hemorrhagic stroke. That last video, we looked at the ischemic stroke. Today we are going to consider hemorrhagic stroke. Hemorrhagic stroke is said to occur when there is a rupture in the blood vessel within the brain, leading to injuries to the brain cells as a result of loss of blood supply to that part of the brain, and also due to compression following the bleed into the brain tissue. The bleed could also occur around the brain, within a space called the subarachnoid space. So there are two types of hemorrhagic stroke. There is the intracerebral, where there's a bleed into the brain tissue itself, and the second one is subarachnoid hemorrhage, in which there is a bleed into the space that surrounds the brain called the subarachnoid space. All of these can cause devastating consequences to the person who has or suffers a stroke. When it happens, it can also be fatal. Up to 40% of patients who develop hemorrhagic stroke die from it, and it accounts for between 15 and 20% of the number of stroke that occurs worldwide. So, what are the causes of this hemorrhagic stroke? Usually it can occur following uncontrolled or poorly controlled hypertension. That seems to be the commonest cause of this condition called hemorrhagic stroke. It can also occur as a result of a ballooning out of the blood vessel within the brain, a condition called cerebral aneurysm. When there is a ballooning out of the blood vessel, the wall of the blood vessel, it makes it more susceptible to bleeding when it ruptures. It could also occur following abnormal vessels that form within the brain, a condition called arteriovenous malformation. It means that the artery and the veins are not well formed, and they become susceptible to bleeding, even with minor trauma. It could also occur in patients who are taking anticoagulants or are probably predisposed to developing increased fluidity of their blood vessel, either because of the medical condition that they are undergoing or as a result of medications meant to treat certain conditions. These are all conditions that can predispose the patients to development of hemorrhagic stroke. What are the risk factors? The risk factors are almost similar. We can stratify the risk factors into modifiable and the non-modifiable risk factors. The modifiable risk factors are those factors that are within the patient's control, while the non-modifiable risk factors are factors that you have no control whatsoever. So what are these modifiable risk factors? Number one on the list is hypertension, diabetes, obesity, people who are smokers, chronic alcohol abusers, drug abusers, particularly drugs like cocaine, use of anticoagulants and antiplatelet medications, sedentary lifestyle. All these are factors or risk factors that can increase the tendency of developing this condition. And the non-modifiable risk factors are the ones that you don't have control over. It occurs in those who are advancing in age. You can't do anything about that. It occurs in males more than females. You can't change your gender. It also has some genetic predisposition, familial tendency, meaning that patients whose parents and relatives have had hypertension or died of stroke stand a higher risk of developing this condition. So how do you diagnose a patient who has hemorrhagic stroke? The commonest manifestation or presentation of this condition is a sudden onset severe headache. Patient will tell you, if they are alive or conscious enough to say it, that it's like something banged their head, like a thunderclap, like a loud sound and a slap on the head. They will tell you that that is the worst headache of their life, and it comes suddenly. That is a classical manifestation of hemorrhagic stroke. That headache is caused by the sudden rupture of the vessel under high pressure, compressing the brain tissue, and that results in that. This may be associated with a feeling of vomiting or actual vomiting. The patient may have seizures, may have weakness of one side of the body. Usually the face is affected. There's drooping of the face. Patients may be confused initially or may become unconscious. Patients may have impaired speech if it's still conscious. Patients may have weakness of the upper limb or the lower limb or both, depending on which parts of the brain is involved. The problem with balancing. And this patient, if it is subarachnoid hemorrhage, may have neck pain, severe neck pain or neck stiffness. Sometimes they may have blurred vision. Their vision becomes unclear or may even see double. Patients may have convulsion. Now, all of these are symptoms that one needs to look out for. If you have a patient who has any of these symptoms, then that patient needs to be taken to the hospital immediately. Remember the FAST that we talked about, FAST, facial drooping. Patients may have inability to raise the upper limb, the arm, may have problem with speech, and it is time to call the emergency number for such a patient to be taken to the hospital as soon as possible. Remember, time is brain. When a patient gets to the hospital, the patient will be examined and a scan of the brain done, which typically would show if there is a bleed within the brain. If the bleed suggests that it is an aneurysm, the patient can undergo what is called endovascular coiling of that aneurysm, which can save the patient's life. Or it could be clipped with special clips through an open surgery is placed to occlude the vessel or the part of the wall of the vessel that has undergone aneurysm, and that prevents further bleed and can be life-saving for the patient. Sometimes other kind of surgery can be performed by the neurosurgeon. So that patient needs to get to the hospital as soon as possible, because the life of that patient depends on how soon the patient gets to the hospital and how soon the patient gets treated. So how can this condition be prevented? Prevention can be stratified into primary prevention, secondary prevention, and tertiary prevention. Primary prevention focuses on the modifiable risk factors which the patient has control over, and that includes lifestyle modifications like exercising, quitting smoking, quitting alcohol, excessive alcohol intake, and ensuring that the diet is a diet that will improve the patient's health, like more of fruits and vegetables, and drinking a lot of water, limiting salt intake. These are all things that the patient can do. And on the side of the doctor, still primary prevention, medications like antihypertensives, drugs for diabetes and lipid-lowering drugs for high cholesterol levels. All these are medications that can help prevent these modifiable risk factors. This is at the level of a primary prevention. Secondary prevention is for patients who have had stroke in the past. To prevent further stroke, these patients need to be put on some medications that will help reduce the risk. Some of these medications include antiplatelet drugs like aspirin and clopidogrel. These drugs help reduce the risk of clots forming in the vessel that could increase the risk of the patient developing stroke, especially if it is ischemic stroke that the patient has. It also may involve using surgical measures to try to improve blood supply to the brain. For instance, a patient who has narrowing of the vessel of the neck that connects the heart with the brain, carotid vessels. When it's narrowed, there are surgeries that can be done to widen the blood vessel to improve blood supply to the brain. For those who have problems with their heart rhythm, like atrial fibrillation, they are put on some medications, anticoagulants, that will improve the fluidity of the blood and reduce the risk of clots forming in the heart and being transmitted to blood vessels in the brain. Now, for the tertiary prevention, this has to do mostly with rehabilitation and ongoing reinforcement of behavioral lifestyle that will help improve and sustain the patient's life. Overall, management of these patients is multidisciplinary, involving the neurosurgeon, the neurologist, the intensivists, the physiotherapists, the nurses. All of these patients need to work hand in hand. The staff need to work hand in hand to ensure that there is improvement in the condition of these patients. So I would like you to share these videos to as many people as you can so that somebody may look out for conditions like this. You can never tell whose life can be saved. And it is very important that we understand that prevention is better than cure. Prevention is always better, safer, cheaper, and definitely much better than cure. So ensure that you carry out behavioral lifestyle that will limit your risk of developing stroke. But when you have stroke, the conditions that may result from it, the situations that you may face may be such that you may not be able to rescue some of the brain cells. And that is why it's very important that prevention is key. So thank you for your time.